Now, coming to the basic framework of an OSCE exam, how can we understand that? What is the basic framework? When we address a station, there should be a structure in our brain. If we do not have a structure, believe me, we will not be able to do the station properly. So, how can we initiate a session? Please do not memorize those points that all these courses tell you. This is the first thing. If, for example, if you're an examiner and in front of you, all the candidates comes one by one and they tell you the same information, what would be your reaction in this? It will not be acceptable for any examiner if all the candidates comes to you and they initiate a session in the same way. It should be different. It should be specific to you. Okay? And if they do not like you in the first minute, also they can fail you. Even if you tell the whole Williams obstetric book to the examiner, if you say the whole guideline of Ireland or guideline of Royal College of Obstetricians of UK, doesn't matter. Your initial first minutes can give an impression to the examiner that this doctor will pass or this doctor will fail the exam. This is very important. How can you introduce yourself? Be very specific, be very short, do not talk too much, do not memorize the sentences, be yourself. And then gathering the information. How can you gather the information? You need to be structured in your information gathering. And the information gathering bit is actually one of the other keys that will make you pass or will make you fail this exam. And this information gathering bit is different from any specific, it is different in every single station. You should not gather all the information from, the same information gathering for all the stations. If you do this, you are going to fail it. For example, a patient comes with constipation to you guys. If you ask about headache, they will definitely fail you. So first of all, the whole information that you gather is about the presenting complaint of the patient. And then you will say, apologies, I'm going to ask you some general questions. Is that okay? Then you can ask you the gynae history, the obs history, blah, 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 blah. And you complete it, okay? And then coming to the next step, after gathering the information, you need to do physical examination. We may need to do physical examination in some stations, but we may not need it in some other stations as well. But we need to have this structure in our mind. Most of the stations, we need to have the physical examination as well. And then after that, what is your impression? In these OSCE exams, they do not want you to give them a proper diagnosis. They do not want you to give a diagnosis. They want you to give an impression. What is the difference between diagnosis and impression? We all know this, right? A patient comes with an acute abdomen. You do not have a diagnosis. It can be a pancreatitis. It can be a GERD. It can be a perforation of the bowel. It can be ectopic pregnancy. It can be anything, isn't it? So if you say that, oh, this is this one, if you put the diagnosis, they will fail you. This is also another point. You need to be honest, and whatever information you give, honesty is the first thing. I have seen, in my experience, I'm sure Anas is also working in the UK and one of the best tertiary hospitals here. And also, not just Anas, all of you, I'm sure you're all working in a good standard, good standing hospitals and medical system in the world. And if you lie to the patient, of course, it will make you fail this exam. Yeah. So if you don't know, you need to be honest. In my last exam, there was a station in which it was a post-op patient. So post-op patient, the clinical scenario and the findings that I had, it was towards an internal bleeding. But I was not sure. So I was too honest. I was like, from this information, I have this impression of you having maybe a bleeding inside. But I'm not 100% sure. I need to involve my team. The first thing, do not take everything on your own shoulder. You are just ST5. You are just ST3 to ST5 level. You are not a consultant. And you are not an God to say, yeah, 100% this is this. No. You don't know. You're just a normal human being. You're a doctor. You have the knowledge. You know how to address it. But you should not say a final diagnosis here. If you say, you will fail it. These specific stations, right? So, and then you say that I think it is something like, could be something like this, could be this. So give some options. 1, 2, 3. 1, 2, 3, this. And then what I'm going to do to diagnose this. Explain this. And tell them that, yes, my knowledge is limited. Confess that you are not complete. Be honest. And then how do you close the station? This is also very important. If you manage your time properly, you can close the station as well very nicely. So this is very important. So you can see that in the left bit of my screen, providing structure. So if you have this 5 things in your brain, how to initiate, how to gather information, you need or not physical examination, how to give a good explanation and good planning, and how to close your station. So this basically 5 things. This should be your structure. And then starting from the first point, even if the examiner is your colleague, if the examiner is your patient, if the examiner is your consultant, whoever. How do you initiate it, and how do you build a rapport and build a relationship with your with the examiner? That's very important. So this thing, please remember this structure I have taken from a very advanced postgraduate OSCE book. So I found it very nice, and I have used it in my exams, and it worked for me. So hopefully it will work for you guys as well, as it is very simple and it is very informative.